A CDC panel is meeting today to determine who will qualify for Pfizer's COVID-19 vaccine booster shot. The FDA granted emergency use authorization on Wednesday. It applies to people who are 65 years and older and to be administered 6 months after receiving their second shot. They also authorized it for adults 18 through 64 years old who are at high risk of developing severe COVID-19 or who are at risk because of repeated exposure through their jobs, such as teachers or doctors. Once the CDC formally adopts recommendations, the Biden administration says it expects shots to start going into arms by the end of the week. CBS News' Natalie Brand has more from Washington.
The FDA has authorized a booster shot of the Pfizer COVID vaccine for certain individuals. It applies to Americans 65 and older, as well as people 18 to 64 who are at high risk for severe COVID-19. It's also authorized for people whose work puts them at higher risk, such as nursing home employees. For now, the FDA rejected Pfizer's request for booster shots for everyone 16 and older.
There's a concern about younger people, particularly men, because of a very rare adverse event called myocarditis.
A CDC advisory panel still has to take its vote on booster shots. The committee is meeting again today. The Biden administration says it's ready to roll out the booster shots as soon as they're approved, possibly later this week.
As President of the United States, my first responsibility is to protect the American people.
The CDC is forecasting COVID hospitalizations are likely to decrease over the next few weeks. But Dr. Anthony Fauci warned Major Garrett on the CBS News podcast The Takeout there's still work to be done to get millions of Americans their first shots.
If we don't get the people vaccinated who need to be vaccinated, and we get that conflating with an influenza season, we could have a dark, bad winter.
About 75% of all eligible Americans, those 12 and older, have received at least one dose of the vaccine. More than 64% are fully vaccinated. Natalie Brand, CBS News, the White House.
To talk more about this is Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, welcome. Great to see you. So the FDA's emergency use authorization for some Americans is a huge scale back of the Biden administration's original plan to have boosters available for everyone. Why would health officials limit boosters instead of getting ahead of Delta and future variants if studies show that the boosters are effective?
Well, what we want this to be is a data-driven process. And when you look at the data, you can see that the vaccine for the general healthy population is holding up really well against what matters: serious disease, hospitalization, and death. So in that group of people between the ages of 16 and 64, there's not strong evidence to support them needing a booster, that it would really have any major impact on their health. And I think that's why the FDA committee voted the way that it did, because the data does exist for those above the age of 65. And I think that's what we want to happen. We don't want this to be a political process where, because politicians want something to happen, it happens, which is what we saw during the prior administration. We want this to be driven by science and data. And that's why I think the FDA advisory committee made the correct judgment on all the data that's out there. And I think the ACIP will do very similarly today.
And right now, the booster is only for the Pfizer vaccine. Researchers are also looking at whether mix and match vaccines are a safe and effective way to boost protection. Can you shed any light on this, especially for people who took Moderna or the single-dose J&J shot?
We're likely going to hear more about Moderna and Johnson & Johnson boosters in the weeks to come as those companies get the data ready to submit to the FDA for emergency use authorization. And I anticipate you'll see a similar process with both of those vaccines. Mixing and matching is something that's not recommended, but it is something that's being studied. And there is some evidence that it might actually boost your immunity more than getting the same version of the vaccine that you got. But right now, we want people with Moderna and J&J to hold tight. I think they're going to hear soon in the next couple of weeks. And the mixing and matching studies, I think, need to continue, because that might be a way to improve our vaccines in the future. And certainly we know that certain countries had done mixing and matching when they had shortages of certain vaccines.
So putting the research on boosters aside for a moment, doctor, are there other effective ways of boosting immunity against COVID? I mean, there are certainly, treatments that are being researched. Are there other things that people can do aside from get a booster shot?
Right now, the only way to increase your immunity is to get a booster vaccine if you're one of the groups that is going to be recommended to get a booster. We have treatments, for example, if you get infected, that we can give you to keep you from needing hospitalization, like the monoclonal antibodies that everybody's been hearing about. And we've got treatments in the hospital, but we don't have any other way to kind of increase your immunity. Obviously, if you get a breakthrough infection, that's going to increase your immunity, but we're trying to avoid people getting infected in general. That's the whole purpose of our public health campaigns. But really, the booster is the only way that we're going to recommend people augment their immunity. But we do have treatments. We do know a lot more about this. We do know what basic things you can do to keep yourself safe if you have a low risk tolerance for any kind of breakthrough infection, like masks and being careful in crowded and congregated places and frequent testing, especially of the unvaccinated.
So some people have already gone out and received their third shot, either because they are in this group that has been sort of greenlit for it. But I know others who've just gone out and gotten one anyway. Still, Dr. Fauci has asked people to wait for official guidance. Are you concerned that his statement and the fact that, some people are already getting boosters, that all of this will add to vaccine hesitancy?
Well, we know that people were getting boosters on their own for some time. Even my own father, who's a physician, got a booster a couple of days ago ahead of the schedule. And I know other people that have done this. What I think we have to do with the boosters is make sure that it's actually being an evidence-based practice, that we actually have strong guidance and recommendations, that this is necessary. And I think we want this to be a deliberate process. There has been concern in the past that vaccine hesitancy might increase with all of this talk of boosters, because someone might say, well, why do I need to get this vaccine? If it works so well, why are people getting boosters so quickly? And I think we have to be careful with that messaging. And I think that's important to say, that it's not the general population that needs boosters. It's those individuals in high-risk groups. That's where we've seen some erosion of the ability to protect against serious disease. And we have to keep emphasizing to people that it's not boosters that are going to change the trajectory of the pandemic in the United States, but first and second doses. And that's what's still more important to me. I'd rather have more first and second doses into people than have everybody that's eligible for a third dose get a third dose, because that would be have a much bigger impact.
Right. That makes total sense. Dr. Amesh Adalja, thank you so much for joining us. As always, we appreciate your expertise.
Thank you.